It just got worse and worse to the point where I just had to say, I can't do this anymore.
Ken Ryan was just 47 years old, and he could barely walk.
A lot of pain.
It was because his right hip was ravaged by arthritis. You can see it clearly in this x-ray. The top of the right femur is deteriorated and rough compared to the smoother left hip.
He had a significant limp because he wasn't able to use his hip like you normally would.
Doctors told him it was a result of a deformity in the hip socket, but years of exercise and sports had made it worse.
And the arthritis was too far advanced for anything other than a hip replacement.
47 seems young for a hip replacement, but studies show patients undergoing these procedures are getting younger and younger. According to the American Academy of Orthopedic Surgeons' latest statistics, more than 277,000 hip replacements were performed in 2008. 40% of those patients were between the ages of 45 and 64. That's a big increase compared to 27% from that age group 10 years earlier. Dr. Sridhar Durbhakula is an orthopedic surgeon at Shady Grove Adventist Hospital.
People are generally more active. They're a lot more health conscious, and they don't want to have to wait.
Dr. Durbhakula says most of the younger patients are either like Ryan, suffering from arthritis, but not willing to give up their active lifestyles, or are obese and putting too much pressure on their joints.
A lot of the younger patients really want to get back to things very quickly. They want to be able to push through the pain and get quickly back to work.
While it used to take 6 weeks or longer for patients to recover from a hip replacement, Dr. Durbhakula says new techniques have patients walking in just days. One example is the Hana table, which gives doctors better access to the hip so they don't need to cut through any muscle to replace the hip joint. Ken Ryan underwent his hip replacement just weeks ago, and he says he's already back at the gym.
It just feels great to be active again.